And welcome back. 10 years ago, 80% of doctors in the Milwaukee area were independent. Today, 80% are employed by healthcare systems.
And one of those practices that remains independent today is the Advanced Ear, Nose, and Throat Specialist, also known as Advent. Gwen Kandula, a board-certified doctor of audiology, and her husband, Dr. Muthan Kandula, are the true mom-and-pop team from Advent. Welcome back to the show,
Thank
both
you.
of you. It's
Hi
nice
there.
to see
How
you.
are you?
Hi, and welcome back.
Thank you.
So, the numbers, I think we were both talking about that earlier before you guys came on. I mean, 10 years ago, 80% of the doctors were independent. Today, 80% are now employed by healthcare systems. What's going on with the flip-flop?
Well, there's been a lot of pressure sort of bearing down on physicians in the community. And most people don't think about it, and we were just talking about this, is that you go see your doctor, you don't really think, are they employed by Aurora, are they employed by Wheaton, are they independent? What does that mean? It does make a difference. I think it makes a difference, or I know it makes a difference, and that's one of the reasons we've chosen to be independent, is it lets me focus on taking care of my patients in isolation, meaning I don't have to worry about what big brother is sort of thinking about what I do and what I don't do and how I'm feeding the system, those sorts of things.
And how does it work when you're going to refer a patient? Is there a difference?
Absolutely. I mean, I think for me, if I'm sending a patient to get a test done or to see another physician or whatever the case may be, I'm thinking about what is the best facility, what's the best physician to see a patient, and I'm going to send them that way. Vice versa, people who are sent to see me by their primary care physicians, there is no leverage. It's either they send them to me because they think I'm going to take good care of their patients, or they don't, and that's sort of that's the reality of the situation. So it plays both ways within a system. If your physician is within a system, they are really told and punished if they don't send somebody down the hall to their in-house facility, that they're gonna hear about it. And most people don't know that, and that doesn't mean that all physicians in those systems are bad or anything like that. It's just those are the dynamics that are in play, and I think it's helpful for people to kind of register that.
Because does it mean a big difference in how they're treated? I mean, is that what it really comes down to with your patients as being an independent?
It does. I mean, I think on when you're not independent, there's a third person in the room. So when I walk into an exam room, close the door, it's me and the patient. That's all that it's about. When it's in a system approach, there's the system is there, meaning that every decision is going to be made in juxtaposition to the system.
There's a management.
There's a management. There's
a
understanding that if somebody's going to have something done, that it has to happen here, not because this is the best place, not because it's necessarily the best place, but because that's what's in the system.
And Dr. Gwen, what does being an independent mean for you as an audiologist?
This has been great, for me as an audiologist, because I'm not beholden to any, manufacturers of hearing aids at all. I need to just keep finding what's best, and as technology changes, I'm able to change my product line and always be able to offer to people what the very best thing for them would be.
And that's what you guys are known for at Advent, to really be on the cutting edge of technology and being able to offer it to your patients.
Absolutely.
Does it also allow you to educate them more about all the new things that are out there and just the newest thing that's coming out on the market?
Right. Yeah, that's why we're here. That's why we come and try to reach out to the public, because if we don't, we don't have the advertising budget of Aurora or Wheaton or any of those facilities, and so it's a matter of letting people know what's out there, and we've got to differentiate ourselves as well as far as being able to offer things that set us apart, and we try to do that on a daily basis, and part of it is being out and being about and letting people know about what their options are.
And you've created a niche.
I think so. Yeah. I think for what we do, you have to. Just in order to survive, that's part of that is being on the edge. You can't be on the edge of everything. So as far as sinus care and sleep apnea care and hearing care, those are the things that we really try to stay on the forefront and try to push the envelope, and that sets us apart.
Yeah, it sets you apart too, because you've even developed some of the techniques and the surgeries that you're doing that you are actually teaching other doctors around the state about, because you have been the first in the state to come up with some of these techniques. I understand that you have great respect for specialists in your field that are also other doctors, but what do you think gives you a leg up on them in the marketplace?
I think really just what you said is I've got to stand out. I've got to be, I can't say better, but I've got to try to be better. I've try to do better on an everyday basis, constantly. So in order to survive, and it's a very, very competitive marketplace, and we're competing with some big gorillas, to mention the other product before. But so, and meaning if you don't bring your A game on a daily basis, you're not going to be around, and that's just the reality of the situation. And I like that. I like that competition.
And have you had patients that have been with some of the larger healthcare systems and then gone to an independent like yourself? And can they see the difference?
Absolutely.
What do they say to you?
What I often hear is we're this best kept secret, and they say, we wish we would have found you sooner. It's been so welcoming, and just our office, the atmosphere is very family. You get that when you come in.
What a nice thing to hear.
It is. You know what was real funny? This spring when we had our third child, I couldn't believe the outpouring of love from our patients. It really is like an extended family. The gifts and the food and all the support that they gave us. It was just really nice to see that they think of us a lot. Like those close relationships like we do too.
Yeah, you're the ultimate mom and pop, just like we said at the beginning of this segment.
Absolutely.
And you're a great team.
Yes, we try to be.
You do. I mean, it sounds like the independent way for healthcare is just so positive, and it has so many advantages. You mentioned that there is pressure for independents to keep turning to the healthcare systems to be their employers. Why is that?
It's control. I mean, so the systems, they want control over everything under their territory, and once they have that control, then they're able to go to insurance companies and leverage that and get actually they get paid a lot more to do everything than when we would get paid, because we're directly negotiating with the insurance company versus Aurora with their thousands of physicians negotiating. So it's just a lot of pressure. As a primary care physician, which I'm not, I'm a special, but primary care physicians, it's very, very almost impossible to remain independent, because you really have, it's hard to set yourself apart basically. And so I completely understand the need or the want to join up, but it comes with its pros and cons.
So as a specialist, I'm sure you recommend people to ask, are you an independent provider or not? And that question can be very important when choosing your next line of care. For more information on Advent, Advanced Ear, Nose, and Throat Specialists, you can get a hold of them at this phone number, or to learn more about them, you can go to advent.md. Thank you so much.
Thank you.
For being here, both of you.